multiple lumps under the arm for a lot of different reasons, most of which are not cancer related.
How young should people start doing self-breast exams? I'm really excited to be here today presenting you with the 7 warning signs of breast cancer. And I'm so excited to introduce my amazing colleague and my really good friend. Her name is Dr. DrDaniFisher. She's a board certified general surgeon and she specializes in caring for patients with breast cancer. So she's the type of surgeon who would do mastectomies, removing breast lumps, amongst many other things that she does. Her specialty and what people really come to see her for is breast issues. So I thought she would be the perfect person to discuss the warning signs of breast cancer with. And, I kind of wanted to just jump into this video by saying, I feel like we are seeing just a huge uptick in young patients with breast cancer. We see patients getting mastectomies and reconstructions who are in their 20s. And the first question I have for you is why? Why are we seeing patients who are so much younger with breast cancer these days?
Yeah, I think it's really difficult. I think it's multifactorial. I think there are a lot of theories as to why we're seeing younger and younger patients, but I don't think there's really one known factor that we can point to that says this is why this is happening. We think that awareness, number one, is much increased.
People are more aware, so they're doing their
checking
breast exams,
right?
Okay.
And they're coming in for certain things. I think, just as in anything, we have to look at our environment. We have to look at our food sources, at the things that we're exposing our body to. And I think that those things are all part of the factors. But I also think that, family history is really the most important thing that I think about when I look at breast cancer risk. And so I think we're just seeing a big uptick in younger patients. And I don't know if that's because the population is just growing in general. Again, it's hard to know exactly why that's happening.
The one thing I always think about is like plastics. Everybody's always talking about, plastic leaching from the plastic bottles that we drink out of and all of that kind of thing. Do you think that that's a risk factor? Like, do you think that the fact that we're using so many water bottles and things like that are contributing to this risk?
I think that that's certainly something that they're looking at. And I think it is, again, responsible for multiple different types of cancers and not just necessarily breast cancer. But I think that, breast cancer is the most common cause of cancer in women, right? And so it's just, there's just a lot of us. And I think that that's why that number is so high.
Right. So the take-home point kind of for me here is the reason that we're seeing so many people with younger breast cancer is because we are more aware. And that's part of the whole purpose of this video. I want everybody to be aware because she just said we're checking ourselves earlier. We're checking for lumps and bumps and all the signs that we're going to discuss in this video because that allows for earlier diagnosis, earlier treatment.
Right.
And in many cases, it seems like from what I see from you, like treatment is just either a lumpectomy or a mastectomy with no chemotherapy, no radiation. Obviously, sometimes there is the need for chemotherapy and radiation, but earlier detection means that you can be done with it with just a resection more quickly. So that speaks to the importance also of early detection. You find it before it spreads.
Right. Most definitely. I think that that's certainly true. I think what we've learned though is truly tumor biology is the key, right? So size of breast cancer and detecting cancers when they're small is definitely important. But one of the things that we've really learned is that small aggressive cancers are as dangerous or even more dangerous than large, more non-aggressive cancers.
So interesting. So the size of the lump does not necessarily correlate.
Doesn't always equal treatment options.
Right.
Correct. Exactly.
Super interesting.
Exactly.
Okay. First of all, how young should people start doing self-breast exams? That's my first question. And what is the best way to do a self-breast exam? I know I've always heard in the shower, but does it have to be in the shower? Can you talk to us a little bit about that?
Absolutely. Yeah. So, what I tell all my patients, and especially, I get this question a lot from my moms that I see that, have younger girls that, they themselves have been diagnosed with breast cancer. So they want to be able to pass on information to their children so that they can be more aware. And what I always tell them is that, body self-awareness can start at any age. There's no right or wrong time to start doing that. So, I encourage girls, even in their young teens to
just to make a habit of it.
Exactly.
Yeah.
Exactly.
Like
and
if you're
learn
doing
your body.
it once a week in the shower, you get to know your breasts, you get to know what's normal, you get to know what doesn't feel normal.
Right. And I think that's the most important thing is just learning your own body, right? Because we're all made differently. And so I think that just learning yourself is super important, and that can happen anytime, right? There's no right or wrong time for that. We also talk about, other risk factors. So women who have a family history of breast cancer, it is recommended that they start getting some type of screening 10 years prior to the youngest family member that was diagnosed, right? Okay. So let's say your mom, for example, was diagnosed in her early 40s. Let's say she's 43. So 33 is really when the time that you should be getting, formal breast evaluation by your practitioner. Well, not necessarily a mammogram. Ultrasound is typically used in younger women because it's better for dense breasts. And so we don't typically like to do mammograms starting that early. But we do recommend getting ultrasounds. And we also recommend just getting a good clinical breast exam by someone who is, who's trained in that.
Right, who knows what to look for.
Exactly. And so your gynecologist is perfectly capable of doing that when you go in for your annual exam. But that 10-year rule is kind of what we use for the beginning of screening in patients that have a family history.
Okay.
Right? In patients that don't have a family history, I think it's important still, as we get older, again, to get a yearly clinical breast exam typically done by your gynecologist when you go in for your annual exam, right? And then based on typical guidelines, the guidelines would be to get your first mammogram when you're 40.
Okay.
And then yearly after that.
So to summarize, tell me if I've got this right. So never too young to do a self breast exam. It doesn't matter what age you are, start doing that as in your teens so that you get used to doing that every week. If you have a family member with breast cancer, then we recommend that you do a screening of some sort, whether that is an exam by your gynecologist in your yearly exam or some kind of ultrasound 10 years before the age that the youngest family member with breast cancer got breast cancer.
Correct.
And then start getting mammograms around 40.
Correct.
And that's if you have a family member with it, or if not, you still start at 40 every year with a mammogram.
Correct. Some women will, if they're, let's say they've had a super young family member, someone in their 30s, right, that has had breast cancer, a cousin or a sister or someone like that, then, they can just really, I think it's an individualized discussion that you need to have with your healthcare professional as far as what you want to do for your screening evaluations. We can, again, start getting imaging as early as in our 30s, but again, typically ultrasound is used. We don't typically get our first mammogram. There was some discussion at some point to get a baseline mammogram between the age of 35 and 40, but really the healthcare guidelines say age 40 is the appropriate year.
Okay. Right. And when I go get my mammograms, they always say, do you want the 3D one? And can you tell us a little bit about like 3D versus non-3D mammograms?
Yeah, absolutely. So, the vast majority of imaging centers have moved to using 3D mammograms. It's just the standard technology now. Some don't, and some will only have 2D, and that's okay. The digital imaging that we have, even 2D, is far superior to what we what we had in the past. Right. And so even a 2D mammogram is better than nothing. And so I think, 3D is always something that you can ask for. And we do think that it is better. It is specifically better in women who have dense breasts. And so that's an issue that we can certainly talk about, is the density of your breast, because I think that influences a lot of these decisions. Okay. As far as what imaging type and things like that you get.
And younger people have more dense breasts.
That's correct. Right. For the vast majority of the time, that's correct. And so 3D mammography is important in that regard. I think the other thing is that, again, with dense breasts, we can always add ultrasound to that, right? So we can do a regular mammogram, even if it's a 2D mammogram, and then we can add an ultrasound to that. And that also increases our accuracy and helps us be more, just not missing things.
Right. So we have lots and lots of modalities then to evaluate and find breast lumps early. Correct. So, the big thing that I just want people to take home from this video is, what are the things that I should look for? What is the number one most common thing we see with breast cancer as a presenting symptom? And I think a lot of people think that it's pain. Like, for example, a friend of mine had pain in her breast, and, she went for a mammogram, and amazingly, they found cancer, but that is actually not the most common symptom for presentation, as I understand it. So what is the most common symptom we find upon diagnosis of breast cancer?
Yeah, I would say it's a palpable lump, right?
Okay.
Specifically in patients who are young, as we talked about, you mentioned the young patients. So young patients typically are not getting imaging, right? So, in a woman in over 40, the most common presenting symptom for diagnosis of breast cancer is actually an abnormal mammogram, right? So abnormal imaging. But in a younger woman who's not getting routine imaging, the most common symptom is a palpable mass in the breast, right? So that's what we would see first.
Okay.
Yeah.
What about a mass in the axilla? The axilla is kind of a fancy name for your armpit. So what about lumps in the armpit?
In the armpit, yeah. So, those are typically, unfortunately, later signs of breast cancer, right? Because the mass typically starts in the breast, and then as the cancer grows, it can spread to the lymph nodes under our arm, right? So they're axillary lymph nodes is what we call those. And those we can feel sometimes. And but again, that's typically a later sign. We see palpable lumps under the arm for a lot of different reasons, most of which are not cancer related.